Polymyalgia rheumatica is a relatively common condition that affects people really over the age of 50. And it shows itself in a number of different ways, but primarily with aches and pains, mainly of the shoulders and upper arms, and also the pelvis and the tops of the thighs. And one of the key things about polymyalgia is that it is often something that people describe muscle stiffness or limb stiffness over and above the pain. And typically, the symptoms are very much worse in the mornings when you first wake up, and they start to ease throughout the day. Often it's associated with kind of a general feeling of being unwell, a feeling of malaise, and it sometimes can take a little bit of time for somebody to come to a doctor or even for them to get the diagnosis right. So polymyalgia rheumatica, sometimes called just polymyalgia, is something that affects people as they get older. It is very unusual in young adults, and it really doesn't happen in children. Generally, we say that adults over the age of 50 are more likely to get polymyalgia. Polymyalgia can be quite a difficult condition to diagnose. We rely very heavily on the description of the symptoms from the patient. And if it fits into a very classical pattern, then we will often make a diagnosis. We nearly always arrange some blood tests as well. And there are a couple of blood tests that strongly support a diagnosis of polymyalgia. So it is important to look at that. But ultimately, it's the combination of the description of the symptoms, examination, and some simple blood tests that allow us to make the diagnosis of polymyalgia rheumatica. Treatment for polymyalgia is really with steroids, and steroids in the form of tablets. And when a diagnosis is made, we try to start steroids as promptly as possible, as quickly as we can. And one of the hallmarks of polymyalgia is that people make a very swift improvement in their symptoms. Normally, within a day or two of starting steroids, it can really be life changing. And so the treatment is tablet steroids that we start at a moderately high dose, and then we reduce them over time. And the reduction slows down, and so that people do tend to be on steroids for a number of weeks, sometimes a few months, before they stop the steroids. And that length of treatment prevents the condition from coming back. So the treatment of the polymyalgia is with tablet steroids, and usually we will monitor symptoms throughout the course of the treatment. A successful treatment means that you finish the course of steroids and you completely recovered and cured from the condition. There are a few patients who do need to have longer term follow-up and occasionally longer term, very low dose steroids, but the majority of patients are fully recovered after the treatment course.